How does someone get diagnosed with a mental disorder? Well, in the US, we use what is called the DSM-5 TR. That is the Diagnostic and Statistical Manual of Mental Disorders, and it's the text revised fifth edition. This came out in 2022. In the DSM-5 TR, there are approximately 298 mental disorders across 22 different chapters. And inside of each diagnosis, you'll find things like the risk factors, the prevalence, and you also find things like a differential diagnosis and comorbidity. A differential diagnosis refers to how to distinguish one disorder from another, and comorbidity refers to what diagnoses, or rather what disorders, are often paired with this one disorder. There's, of course, problems with the DSM 5 TR, like the problem of comorbidity. For example, one symptom, like insomnia, exists across 22 different disorders across 8 different categories. There's also the lack of contextual factors. For example, hoarding disorder, one of the symptoms is that your living space is cluttered. If you're of a lower socioeconomic bracket, you might be living in a smaller living space, which means that you might be disproportionately represented in that disorder. And then, of course, there's the problem of heterogeneity. One disorder can have different combinations of symptoms. For example, PTSD has 636,120 different symptom profiles. So that's definitely a problem. But now you know a little bit more about the DSM, you know about mental disorders, and you know about how diagnoses works. So now you don't have to wonder.